I'm Devera Gabriel, and I'm here to present information on the OMOP and FHIR Working Group. Meeting with all of you and hosting the FHIR and OMOP Connect-a-thon at last year's Global Symposium generated a lot of interest and enthusiasm in our working group. This slide shows organizations for the 57 of the 68 individuals that have attended our working group meetings since the symposium. These are a diverse group of people from divergent geographic regions, representing industry, academics, care providers, and government agencies. Not all of these folks attend every meeting, but we've established a consistent core group of contributors and are averaging around 19 attendees in every meeting. As such, we're grateful for all of this interest and support. And it makes us feel as if we are absolutely on the right track. And all of this hard work is truly of value to both the OHDSI and HL7 communities. So now let's talk a little bit about what that is. Next slide, please. Our working group purpose has remained the same since last year. We focus on creating and validating standard bidirectional transformations between FHIR and OMOP. Next slide, please. Our 2024 objectives include completion of a draft implementation guide that specifies transformations of FHIR to OMOP for common core EHR data in partnership with the Vulcan FHIR Accelerator. We will host one or more testing and validation events supporting implementation guide development. And in response to OHDSI's desire to facilitate more cross-working group collaborations, we will partner with the Health Equity Working Group that you'll hear from next that will leverage their expertise when generating the social determinants components of our implementation guide, transforming FHIR standards for gender harmony and occupational data for health. Next slide, please. So if any of this sounds interesting to you, please join us. There's always a chair waiting for you weekly on Wednesdays at 3 p.m. Eastern. And with that, I'll turn it over.
Great. Thank you so much, Devera. As she mentioned, we are on to our Health Equity Workgroup and Atif Adam.
Thanks, Greg. Can you hear me?
Yeah, I can hear you.
Perfect. Yeah, this is Atif Adam. I'll be speaking on behalf of the Health Equity Working Group. Similar to Devera, we had a whole bunch of objectives that the group tries to maintain. A key part of that is generating and disseminating substantial work around health equity and inequities across our studies. We've been working closely on adding in social determinant factors and building extensive tool sets that can expand out our OHDSI work itself. A key part of our work has been engaging the broader community both within OHDSI and outside OHDSI on enriching the work we do in terms of health equity with related projects across all network studies. Something that we wanted to focus on this year, Craig, if you want to go to the next slide, is trying to keep things simple in terms of our OKRs for 2024. So we framed it around three broad areas: research, engagement, and integration. These are key areas that the work group members wanted us to focus on. So research is kind of adding into some of the work we're doing, where equity work is presented in network studies. Engagement, how do we better engage the community itself? And integration is primarily working with other working groups at IQ in OHDSI, as well as groups outside OHDSI itself. Next slide. So based on this, for research, our milestones that we hope to achieve by the end of the year are having at least 2 health equity-oriented studies coming out of our work group and inviting OHDSI and non-OHDSI speakers to present their work in an ongoing journal clubs. For engagement, we want to extend to have 2 webinars and workshops outside the symposiums where we invite experts and committee members on key areas, either as cross-collaborative work similar to what Devera mentioned, or work groups projects as well. Integration, so we've been working closely with other work groups, but we wanted to kind of keep that as milestones as well. So with the GIS working group, we want to quantify the impact of social environmental determinants of health on healthcare resource allocation. And just like Devera said, working closely with the OMOP to FHIR working group, gender harmony and occupational data health amongst the groups itself. The stretch goals are something that we hope to achieve, but we don't want to keep it as something that we want to do. But mostly it's getting our work out in some sort of publishable format, but also having a mechanism where community members can respond back to us either through the forums or have other channels to grow our responses year to year. Our work group meets on the second Wednesday every month, and we have a channel on Teams as well. So looking forward to having everyone there.
Great, Atif, thank you so much. Next up is our Africa chapter. I'm just going to go through the full first slide here. And Cynthia Sung.
Hi, everyone. So for the Africa chapter, our purpose is to strengthen awareness and capacity for data harmonization and analysis using OHDSI tools to meet the data-driven evidence needs of African researchers, health providers, and governments. And I've been fortunate that this year, Agnes Kiraga has agreed to help me co-lead this chapter. Agnes is a PhD in biostatistics from Makerere University in Uganda, and she did a postdoc at Johns Hopkins School of Medicine and Biostats. And we meet every other week at Monday at 10 a.m. And the next one's going to be March 4th. So we set up a survey with about 9 different topics to get feedback from the group about what our objectives should be for 2024, and 5 rose to the top. So one objective is to create a guideline for African data access. So Mark Twagiru Mukiza from Rwanda, when he was setting up an OHDSI network in Rwanda, he spent about a year working out a data access agreement. So we'll try to leverage on his experience in that and get a language so that we could accelerate getting those approvals. So we hope to get at least a few more approvals to start working on our objective number 2, which is to do ETL of databases. And our target is to do an ETL for 2 databases. We've got quite a number of members who've agreed to lead that. Mark Igata from Kenya, Henry Ogoe, and Kofi Agiari from Ghana, and Azi Tao from the US Mahara University. And Agnes, who is at the African Population Health Research Center now, she has a training data set which she and her staff will help lead us through the ETL steps. And we expect that during this process, we will identify vocabulary gaps, and then we'll try to prioritize what are the vocabulary needs in use cases that we'd like to go forward with. And Andy Cantor and Jared Hodeling from the US and David Amati from Kenya will be helping lead that. Next slide, please. Oh, sorry, back. And just to say that we spent a lot of time last year working on a value proposition, and so we will apply all that work in developing a very concise statement to meet with like data owners so that they give us permission to go forward and understand the basic goals of the chapter. Next slide. So we also need to get funding, and thanks to Andrew and Marty Alvarez at Tufts, they've agreed to add to their regular searching of websites where there might be grant opportunities, several that we think have opportunities for African researchers. And so once we prioritize a grant application, we hope at least to submit one multi-institutional or multinational collaborative proposal. And Azi and I will lead that effort. Earlier last year, we had a sort of a background meeting with the Africa CDC, the US CDC, and USAID. And there's a lot of interest on the Africa CDC, on the OMOP, CDM, and methodology. And so our goal is to try and solidify that collaboration by developing an action plan with those three institutions. And Agnes, Niga Debrizius, and Chidi Azuzi will help lead that. There was a lot of interest in participating in a network study. That's sort of more of an individual choice. But if you have a network study that's beginning or in the early stages where you could have still people joining, I know that Craig's got a site, a web page where there are network studies. Could you post them up there, and then I'll try to bring those to the attention of our members. So next slide. So we've got a lot of work ahead for us, and just to point out again that we have our biweekly meeting on Monday at 10 a.m. And for the next meeting on March 4th, Agnes will be presenting on a grant that she recently got from Wellcome Trust called Data Science Without Borders. And then we also have a woman, Mariam Derizen, from Leiden University, who has set up a data harmonization network around COVID research that she launched during COVID. So we'll see how far she's gotten and whether we can synergize with her effort. It's called VODAN, if anyone's interested. So please join us for that one. It should be very interesting, or for any of the other ones. Thanks. That's it.
Next up is going to be Wade Shipman with the new Electronic Animal Health Records Workgroup.
Hi there. Good morning. Yeah, we've just started in January. We've had 2 meetings. We've been very welcomed and encouraged, so we appreciated that. So the purpose of the group is to improve decision-making and care for animals and people through evidence generation, support comparative medicine, zoonotic and environmental disease analysis, and analysis of the human-animal bond on health and the quality of life is what our main purpose is. Next slide, please. So since we're new, our main objective is to make sure we hold monthly meetings and facilitate the exchange of ideas. We've had some good participation from the veterinary teaching hospitals, plus some other members that have joined us and given us some good ideas. Next slide, please. And so our second objective is to propose solutions to support the use of animal health data for research in veterinary and human medicine. We've begun analyzing the OHDSI components, CDM, the vocabulary, and the software tools as they relate to animal health data. And we want to document the modifications that are necessary to successfully ETL animal data, to include the methods, develop some guidelines, experiences, and other artifacts that support successful ETL of animal data. Our goal is to make sure that any other teaching hospitals or so anyone that has animal records that want to get involved would have some sort of resource to go to and not have to reinvent the wheel. So our key results in the first quarter is to identify the current users of veterinary users of OMOP CDM, which we started, support the update of veterinary extension to SNOMED CT and Athena, which is also in progress too, and then begin the review of current usage of the OMOP CDM at the veterinary teaching hospitals, especially looking at the data dictionaries at each institution. Each institution is doing it a little bit different, so we want to harmonize that between the groups. In the second quarter, we want to continue this review of the existing work of the data dictionary and the current use of the CDM at the veterinary teaching hospitals, so we can identify the difficulties encountered and ongoing needs, and begin a consensus development of a prototype for the modifications or extension needed to use OMOP CDM in animal records. Next slide, please. And by the third quarter, we want to start developing some formal documentation of those recommended modifications or extensions for presentation to the OHDSI Common Data Model Workgroup for review and guidance. And so next slide, please. And so by the end of the year, we hope to finalize that documentation for presentation and review and initiate the development of a list of software potentially useful for ETL, cohort identification, and data quality assessment of animal records, and begin to identify any modifications that might be needed to use the software. So we've tried to set some reasonable and accomplishable goals in the first year so we don't overextend ourselves and get overwhelmed. And again, appreciate the support and encouragement that everyone's given us, and look forward to having a good report for next year. Thanks.
Great. Thank you, Wade, and thank you for your work in bringing this work group together. Anna, can I hear you? Let me see.
Yes, I think you can.
Okay.
Hear me.
Here we go.
Well, now it's actually even better because both of the people before me mentioned some vocabulary needs. And Vocabulary Workgroup is the place where you ask questions, come with your needs, and the place that we use to highlight what's going on with the vocabularies. And on the next slide, I will spend some time just showcasing what we did last year, and everything is recorded so that you can go to the channel and see any of the recordings that we had. For example, we discussed what we do with Loying's Nomad hierarchy, or we had wonderful speakers who talked about their tools to track vocabulary changes. And also beyond vocabulary Workgroup, there are lots of things happening with vocabularies. And a couple of things that I wanted to highlight here is that we had landscape assessment. We established committee and the roadmap, and we have documentation that we're moving in the GitHub wiki. So if you have any questions, please check out the wiki. It has lots of resources. And we also published the vocabulary paper. So if you haven't seen that and you need something to cite in your research about vocabularies, check out the paper, read about principles, read about what we've done over the years. Now with that, let's see what we planned for 2024. The very first thing is, of course, to continue supporting everybody else. We did the landscape assessment, so we want to continue that, and we want to be in touch with the other work groups to keep our hand on pulse and see what the needs are and how we can incorporate that into our work plan. We also want this year to hold office hours so that you can easily pop in and just ask any questions that you might have about the content of the vocabularies, about the processes, about how to contribute, and so on and so forth. The second objective is to really work more. We've done that already, but we want to continue working on transparency. So make sure that everybody knows about proposed changes, that everybody can see what we're planning, what the content is, what we plan to improve. We also want to have external speakers, and we're gathering people to talk about their experience with the vocabularies. If you converted or mapped your vocabularies, we want to hear about that. We want to learn from what you've done and maybe improve on that. So if you have something to say or present about your experience, please reach out to me so that we can have you as an external speaker. And the last objective is to really engage as many people as possible in the vocabularies, given their importance. So we are having at least one joint community activity, and the focus will be educational for Global Symposium. We're also planning something for European Symposium. And if you have something in mind, if you want to participate as the member of the planning committee, I posted the slide that asks for participation. And if you have, again, if you're willing to have more impact on these types of activities, please sign up, and we will have our first meeting very soon.
Great. Thank you, Anna. Next up, it's been a busy month for our Phenotype Development Evaluation Work Group. I'm happy that Gautam is able to share OKRs.
Thank you, Craig. So for 2024, we have three main objectives that we want to work together on. The first one is one of our main objectives, which is to enhance the science of phenotyping and best practices around it. So as part of our key deliverables, one deliverable that we are aiming for is to publish a paper or a communication on the OHDSI Phenotype Library by Q2 2024. This is currently in an advanced draft stage. One Banda and I have the draft available for the community. It's on the Microsoft Teams environment. If you would like to participate or will contribute, please let me know. We want to conduct a network study to support methods on incorporating measurement errors into background incident rate estimates by Q4 2024. This is an effort that is led by Jamie Weaver that he has initiated as part of the Phenotype February 2024. Communications on those are on the forums and also has been discussed in the Phenotype February effort. The next key objective that we are working on is the community engagement and educational outreach. This is a collaborative effort. So our key result for this is to complete Phenotype February 2024 through a collaborative set of activities on the theme of heterogeneity in phenotype algorithms in published literatures by Q1 2024. This effort is being led by Azish Ivy, Jamie Weaver, Asiye Golazar, Anna Astropoulos, and the communications are on the Odyssey forums and through several meetings. As part of this effort, we're also conducting a few Atlas demo training and demonstrations, and we would like to complete 3 of those by Q1 2024. Another objective that we want to work on is the maintenance and development of tools for phenotype development and evaluation. One of the key tools that this work group maintains is the Odyssey Phenotype Library, and we would like to complete 3 refreshments of the Odyssey Phenotype Library, 3 major releases by Q4 of 2024. We also want to work collaboratively with the community to develop a submission tool for community contributions to the Odyssey Phenotype Library by Q2 2024. This is currently being worked on with Juan Banda and me, and any community involvement would be very welcome on the development of this tool. We have a goal. We have an objective of we want to deliver on something we call as objective failure criteria for cohort definitions. There are currently in some concepts on this one, and by end of Q4 2024, we want to deliver on this metric on an objective criteria that says this cohort definition passes or fails some criteria.
Great, thank you, Gautam. Next up is our Dentistry Workgroup, and it's going to be Robert Koski.
Thank you, Greg. Good morning, everyone. My name is Robert Koski, and I co-lead the Odyssey Dentistry Workgroup with Danielle Boyce. The Dentistry Workgroup's mission is to understand how dentistry can leverage observational research to improve oral health outcomes and further investigate the links between oral health and systemic disease. We have 3 main objectives and key results for the first half of 2024. First, we want to increase the workgroup's collaboration with the broader Odyssey community by publicizing our ongoing projects and efforts. We also plan to host guest speakers from both within and outside the Odyssey community to discuss the challenges that dentistry faces to performing observational research and opportunities to overcome those challenges. Second, we want to increase our understanding of observational research in dentistry. Over the past year, we've been working on a scoping review on observational research in dentistry that is nearing completion. We hope to submit the article for publication in the coming months. We also presented a poster at the Odyssey Symposium on challenges to completing observational research in dentistry that we hope to expand on in future endeavors. Finally, we want to further develop the capabilities of the dental community to conduct observational research and identify opportunities and challenges for observational research in dentistry. We submitted our first dental phenotype to the Odyssey forums and are actively working on improving and refining it for use in an OMOP study. We have several more phenotypes that we plan to submit to for the community's consideration, and the Dentistry Workgroup also plans to submit a use case to the Sisyphus Challenge and acquire a dental data set to conduct an observational research study on. The Dentistry Workgroup is a diverse mix of clinicians, researchers, private industry, and academics. About half of our participants are not dentists, and many had no dental experience before joining. If you want to work on expanding observational research to a new frontier of medicine, tackle unique challenges to conducting research, and solve critical health problems for our patients, please join us in helping improve oral health. I hope that you'll consider visiting our work group. We meet every Thursday at 7 p.m. Eastern Time on Microsoft Teams. Thank you very much.
Great. Thank you, Robert, and appreciate the Odyssey branding on the fleece. Next up, we're jumping around here. Paul Naji. Paul and Chan are on the medical imaging work group.
Yeah, thank you, Craig. Next slide. So the medical imaging work group, the goal is to combine medical imaging research with Odyssey-based research. So we want to be able to bring in features for medical images. There's a lot of metadata around DICOM images, around how the images are acquired, as well as bring in segmentation features from algorithms that classify and create features out of medical images. So our goal is to be able to perform cohort definitions in Odyssey that can then identify medical images and then be able to then take algorithms and bring the features from those algorithms into the OMOP model to conduct reproducible research. So our goal is to then create a imaging-based federated network to be able to do large-scale research on medical imaging. The next slide. So we have recently published our paper, our reference implementation of the imaging extension for imaging. I posted it in the chat. We are now we're now harvesting the DICOM standard. It's a very large standard where we have pulled out most of the vocabulary of it. The good news is most of the vocabulary is coming from SNOMED and LOIC we've already checked that's included within the OMOP data model. There's also quite a bit of conformance testing within the DICOM standard that we're trying to incorporate as data quality tests. And our goals this year will begin to start doing some real-world DICOM analysis across multiple institutions around Alzheimer's, which is going to be using MR, COVID, which will be using chest x-rays, and lung cancer, they'll be using CT. So we wanted to cover different imaging modalities as part of this process, and we start seeing how in the real world DICOM data standards are being met. And so our working group meets every 2 weeks on Wednesday, either in the morning or the evening, all at alternating times. Thank you.
Great, thank you.
All right.
Let's try Alcia. Oh yeah, I hear you.
All right. So for the medical device group, I compare what we did for last year and then present what we want to do this year. So last year, the goal was for the whole group, the goal was to establish subgroups and then start responding to the FDA RFIs and then establish collaborations. And then we planned the first meeting at the global annual symposium. So we did expanded our subgroups. Michael Massini, he joined and leads the device adverse event subgroups. And besides, we respond to the FDA's RFI, we responded to 2 NEST CC RFP. And then we had the presentation from the surgery and the perioperative medicine working groups. So this year, for the whole group, we continue building the partnership, including NetCC and the cross-functional Odyssey working group. For example, the imaging, we will invite them to talk to us. We will continue holding one face-to-face meeting at the 2024 annual symposium. Next. So for one, we have 3 subgroups. So the first subgroup is device ID data subgroup. Lead is Carrie Bosella, and as you know, for the devices data, we focus on working on exploring the Odyssey data and what's the device data out there. So what we achieved is that I did some exploration of Odyssey device vocab and procedure vocab, and Carrie shared their company's device attributes, that is about a few hundreds. And San Chong Yun, he provided his mapping on UDI, EDI, SNOMED mapping. Next. So for this year, we want to deep dive into the Odyssey vocab for device and procedure. We have a lot of goals. For example, establish a medical device branch in the Odyssey device vocab, establish UDI as a standard and the FDA Pro Code as a classification, and also asking help Senchon EDI as a non-standard. We also will compare the Odyssey vocab relationships with the medical device semantic model. And we did some primary work on mapping to the FHIR from the OMOP. So we will collaborate with Tufts to test that mapping. And for all this vocabulary work, of course, we have to collaborate with vocab working groups. Next, I will invite Andrew Williams to speak for your subgroup.
Ah, I didn't know that was coming. Let's see. So over the past year, let's see, we clarified which standard concepts are available. In general, we're looking to develop a standard strategy for managing and representing waveform features and other device-generated data. So that would include, the distinction there is between ECGs, EEGs, and things that are properly waveforms, and versus other wide data sets that come out of medical devices like respiratory information and other things that might not be waveforms, but we group them all together in this format. And we say we're looking at the coverage of the features of those things in standard concepts and developed a strategy for addressing gaps in those concepts. And a lot of that was based on prior work we'd done largely in collaboration with folks from MIT on Mimic 4 as a sort of a testbed for that, and developed a strategy for that. And a lot of that, Polina Talapova and Mela Kwong and Tom Pollard and folks from MIT worked a lot on that. And this year, we are going to be extending that work to do contributions to the OMOP vocabulary using the wonderful community vocabulary contribution framework that's been set up by Anna and the vocabulary team, and to demonstrate the strategy for supporting standardized analytics across these kind of tabular EHR data with the files that represent the actual data themselves. So we want to extend that work, which we've kind of sketched in prior years. That's what we'll be doing this coming year.
Okay, so for the other group that is led by Michael Massini, what we achieved that he becomes the lead for this group. So for the 2024, we have two goals. One is we will survey the OHDSI members' capacity to conduct medical device RWE research. So I ask you for collaboration when we reach out. And the second, we will see if we will kind of see, based on the first goal, to see if we can conduct a OHDSI network study led by Michael Massini. That is all to advertise our group. We meet every 3 weeks on Thursday. One is at 9 a.m. ET, and another one is at 12 p.m. Welcome to join us.
Great, thank you, Asya and Andrew. I believe last up for today is our GIS work group, and this will be Kyle.
Hi, thanks, Craig. The purpose of OHDSI GIS is a little more generally than this, to support the use of place-related data in combination with clinical data to understand the impact of various geographic attributes on exposures, care delivery, and health. I co-lead this group with Andrew Williams and Robert Miller. So first, we had a pretty big last year. Some of the highlights were we developed OMOP vocabularies for GIS, SDOH, and environmental toxins, came together with an end-to-end example use case that demonstrates integration of place-related data into OMOP and how it could be used for a really simple analysis. We got a CDM extension table developed and tested internally. We're ready to propose that to CDM working group and get some feedback from them. We expanded the functionality of our metadata catalog to handle local data sets, which was a request from some people. And finally, we conducted a survey of geocoding tools that are fit for using patient data. So we've got 3 objectives for this year. First one is around documentation. We've done a lot, and we really want to become more transparent generally about that. So completing our vignette style documentation specifically for orienting and on-ramping new users so that people can get started with all the work we've done, take that and start integrating place-related data. Beyond that, one last one was just to improve the transparency of our internal working. So we want more development roadmaps and readiness for adoption metrics for all of our software and vocabularies. We've done a lot of work just on sort of meta work group work of how we organize our meetings, how we organize our work. We've sort of are testing out this use case leadership structure. So in completing the transition to that, we're hoping to acquire 3 guiding use cases where a collaborator will sort of submit a proposal for the evidence they want to generate using place-related data, and then we'll work with them to sort of fill in the missing spots in our infrastructure or in our vocabularies or software or metadata catalog. And then, you know, along with that, we want to foster collaboration with other OHDSI work groups. So we're super excited to work with ATIF and the Health Equity Work Group, and we're hoping other OHDSI work groups will also be interested. If you see that link at the bottom there, there is a drop-down menu on that site called Getting Involved, and you can see use case proposals. That's one way to reach out to us. Other than that, we meet every Friday at 10 a.m. Eastern, and you're always welcome to join. And finally, we want to continue to develop and mature Gaia functionality and extensions, and Gaia is sort of like our suite of software and catalog infrastructure. It's sort of a catch-all for the stuff we've developed. First, we have the data catalog, and we want to secure a sustainable platform for that so that it's a public resource. We want to propose and integrate our CDM extension table into the OHDSI ecosystem. We want to expand the metadata-related functionality. We want to enable automated retrieval from API data sources. And finally, we want to develop a Hades package that does appropriately adjusted analytics with spatiotemporal data to sort of pull everything together. So yeah, we meet every Friday at 10 a.m. Eastern. There's information about getting involved on our site. There's more information about what we've done there as well. We really hope you join us.